Good morning, teacher. Today we're going to present the second topic for the oral presentation. The topic for today is surgery.
What is surgery? It's a procedure to remove or repair a part of the body or to determine if there is a disease. Surgery is also the branch of medicine that specializes in the diagnosis and treatment of disease or conditions through operations.
Function of surgery. Surgery is a procedure to remove it or repair a body part or check the sear. It can be used to extract or treat any disease and inheritors or to alter the appearance of the body. Surgery is all the branch of medicine that specializes in the diagnosis and treatment of diseases or conditions through operation.
Types of surgery. I'm going to explain the three main: the emergency, the urgent, and the schedule. First of all, we have the emergency. Emergency surgery is the surgery to treat trauma or treat illness due to an emergency presentation. The patient may require immediate surgery or present for a surgery at a later time following this unplanned presentation. Emergency surgery includes unplanned surgery for admitted patients and unplanned surgery for patients already awaiting an elective surgery procedure. Some examples are aneurysms, severe trauma to the head, chest, abdomen, or extremities, and also cardiac events such as heart attack, cardiac shock, and cardiac arrhythmia. Then we have the urgent surgeries. These are the surgeries done for urgent, possibly life-threatening medical conditions, such as serious injuries from an accident, testicular torsion, or acute appendicitis. Some examples are amputation and hernia repair. Then we have the scheduled surgery. It's also known as an elective surgery. It's a surgery that can be scheduled in advance. It may be a surgery you choose to have for better quality of life, but not a life-threatening condition. But in some cases, it may be a serious condition such as cancer. Some examples are cataract surgery, mastectomy, and lymph node removal.
Branches of surgery. Cardiovascular surgery describes any surgical procedure that involves the heart or the blood vessels that carry blood to and from the heart. General and digestive surgery is a surgical specialty that focuses on abdominal contents, including the esophagus, stomach, small intestine, large intestine, liver, pancreas, gallbladder, appendix, and bile ducts. Oral and maxillofacial surgery, it involves operations to correct disease, injuries, and effects of the face, jaw, or mouth. Orthopedic surgery and traumatology. An orthopedic surgery is any operation performed of the musculoskeletal system. This system is comprised of your bones, muscles, ligaments, joints, and tendons. Pediatric surgery. The pediatric surgery is a subspecialty of surgery involving the surgery of fetus, infants, children, and young adults. Plastic, aesthetic, and reconstructive surgery. Plastic surgery is a surgical specialty involving the restoration, reconstruction, or alteration of the human body. Thoracic surgery. Thoracic surgery refers to operations on organs in the chest, including the heart, lungs, and the esophagus. Neurosurgery is the last one. Neurosurgery is the surgery of the nervous system.
What is a surgeon? What is a surgeon? A surgeon is any doctor who is capable of preventing, detecting, and curing diseases by performing a surgery. What does a general surgery do? General surgery diagnoses and surgically treat different pathologies that can be located in the digestive system, the diseases of the esophagus, stomach, small intestine, colon, and rectum. Despite the term general, these specialists are highly qualified professionals and experts in sol solving complex pathologies such as the bronchial. Despite being general, these specialists are highly qualified professionals and experts in solving complex pathologies, such as the approach to advanced tumors, be able to connect with other specialists addressing the patient's problem in a multiple way.
Instruments used during surgery. The scalpel. It's used for the initial incision and cutting tissue. Consists of the blade and a handle. Surgeons often refer to the instrument by its blade number. Then we have the scissors. Are used for cutting tissue, suture, and dissection. Scissors can be straight or curved and may be used for cutting heavy or finer structures. Then we have the blades. Surgical blades are used for cutting skin and tissue during surgical procedures. The most common type of scalpel blade used during surgery is non-attachable and replaceable blades. Clamps, also called locking forceps. These are ratchet instruments used to hold tissue or objects, or provide hemostasis. Can be traumatic or atraumatic. Needles and sutures. Needles come in many shapes and cutting edges for various applications. Sutures can be absorbable, non-absorbable, and it's available in different sizes. Retractors. In varying forms, retractors are used to hold an incision open, hold back tissue or other objects to maintain a clear surgical field, or reach other structures. They can either be handheld or self-retaining via a ratcheting mechanism. Suction. Suction tips combined with a suction source help to remove debris and fluid from the surgical field. It can also be used to clear surgical smoke. Now I'm going to explain some recommendations before and after surgery. Doctors often recommend before surgery to stop drinking and eating for a certain period of time before the surgery, to bath or clean and possibly shave the area to be operated on. Do not wear makeup the day of the surgery. Do not wear nail polish. Do not wear eye contact. Leave valuables and jewelry at home. Any advice via medical staff of dentures or other prosthetic devices you may be wearing. And some recommendations after the surgery are to rest, because resting is important for recovery. Not resting will delay your healing time. Ice or cold therapy. Using cold therapy frequently throughout the day will help to decrease swelling. Elevation. Raising an extremity above the level of the heart helps to decrease or prevent swelling. Keep your incision site dry. You will be allowed to drive. Once again, you're given the approval by a doctor and only once it's deemed safe for your safely operation of a vehicle. Plan to take leave from work for at least 7 or 10 days immediately after the surgery. Returning to work safely largely depends on your type of work and the effective pain management you have.
One of the common side effects at the surgical site is swelling. Some swelling at the surgery site is normal. A surgical cut in the skin is a form of injury and the body response is inflammation. We also have intestinal obstruction. This occurs mostly after abdominal surgery. Headache after having epidural anesthesia for pain, surgical wound hematoma, collection of blood, that is a collection of blood at the wound site, and the surgical wound open. Okay. Thank you so much for the attention, and we hope you could understand what is surgery.